You know, I'm so proud to call her a friend. Erin Porter has written a book. I met Erin 7, 8 years ago, something like that. Eat, Pray, and Get Well is the name of the book. She has been through so much. When we talk in the green room, when I see you, you were here a couple years ago. And Don Dennis did some work on you, has helped you through your sinus problem, Dr. Don Dennis in Atlanta. But when I see what you have been through, and I want to post something here, it's graphic, but I want you to see it. This is called a Mohs procedure. I remember doing these when I worked in dermatology. That's you, Erin. That's you on the left and you on the right. Walk me through that. What had transpired there?
Well, I had a tiny little spot about the size of a freckle.
Yeah.
And never imagined it would turn out to be, you know, skin cancer, basal cell.
Yeah.
But underneath, you know, it was probably the size of maybe a nickel. So I had to get the flaps from the forehead and the cheek and have the reconstructive.
And during that procedure, they take samples, you know, to make sure they got it all, which I think is great. It's called Mohs, M-O-H-S, procedure that doctors can do. I'm looking at you now thinking, wow.
He did a good job.
Maybe makeup is great, but that guy was an amazing doctor. Tell me a little bit about a word called aspergilloma. First of all, can you define that word, and then can you tell us how it was diagnosed?
It was diagnosed finally, I believe, by our wonderful friend Dr. Dennis in Atlanta.
Okay. And
I had already had chronic sinus infections for probably 25 years before I went to Dr. Dennis. And he is the one that diagnosed it as aspergillomas. I had already known I had a fungus called curvularia, you know, that I was trying to get rid of. But what was interesting is that I learned it's those same aspergillomas that can grow in your lungs and oftentimes get misdiagnosed for cancer. So sometimes I think, you know, if it hadn't have been where you can see it with a scope and a good doctor who knows what he's looking at, and it had been in my lungs instead, I just wonder if I would have gotten that cancer diagnosis. So it taught me, if anyone ever says, we see a lump, we see a mass in your lungs, I would definitely send that out for fungus. You know.
And not only that, how many women have polycystic, you know, ovarian disease, polycystic kidney disease? How many have, you know, masses growing in your sinuses, your colon, right? It just amazes me how they're all cancer, or, you know, just a polyp. But you got to rule out fungus. Even the Center for Disease Control is now saying, think fungus. It's like they're shaking doctors. You know a lot about bacteria, a lot about viruses, or so we thought. But think fungus. You know, it's time we think fungus. How did fungus impact you? What was the worst that it caused you?
I had symptoms head to toe. I would say the scariest symptom was probably the heart arrhythmia. The most frustrating was the sinuses. I had 4 surgeries, and there was nothing. There was no amount of antibiotic surgery that was going to heal these sinuses because I didn't know what I was dealing with. And ironically, you know, the doctor gives you antibiotics for your sinus infection, and if the Mayo Clinic is correct, which I think it is, you're feeding the fungus that's in your sinuses and making yourself worse.
With the antibiotics?
With the antibiotics.
It blows me away that our brightest and best don't understand this simple concept. You brought this up. Aspergillomas are well published as, guys, before you diagnose you know, liver, kidney diseases, rule out fungus, especially aspergillomas, pulmonary aspergillomas. This is an aspergillus fungus that grows in a ball, and it mimics lung cancer. And I have to wonder how many people are getting chemotherapy today because they have a fungal condition in their lung. According to science, quite a few. How did you finally get better? Or do you consider yourself always improving?
I would say always improving, because we talked about it earlier, I do have that MTHFR gene. So I think, and I was hit so hard, I think that I always have to be careful. I have to be careful what I eat. I have to be careful of buildings that I go into. But I feel good. I feel better than I did when I was 19, 20, 21 years old, more energy, and I live a completely different lifestyle now.
Wow. It was 18 years old. She moved to Manhattan, moved into Imagine. It was probably a $10,000 a month flat, but it was loaded with mold. She kept getting sicker and sicker while her girlfriends all went out at lunch. she pretended she was going out at lunch somewhere else and went to a different doctor all the time. The story is in the book, and this should become a runaway bestseller. Eat, Pray, and Get Well. Same URL, eatpraygetwell.com. Buy a copy. Buy a Christmas gift. Buy 10 of them. Thank you, Erin, for coming in.
Thanks
Good
for
to see
having
you
me.
again.
Thanks.